The emergency department at Sharp Grossmont Hospital is the busiest in San Diego County. It's not unusual for paramedics to wheel in somebody they suspect of overdosing on narcotics.
Often they're not breathing as regularly as someone would if they're not on narcotics. The respiratory rate is very decreased, and they're usually unconscious.
ER Dr. Danielle Douglas says that's when it's time to inject a patient with naloxone. She says the drug revives them almost immediately.
Which is great because it can save someone an intubation where they end up on a respirator. It can potentially save them from death if they're in the field and the paramedics get there just in time, and also save them from a lifelong complications of anoxic brain injury.
Naloxone has been around for more than 40 years. It's been the overdose antidote of choice for ER doctors and paramedics. But with the steady rise in overdose deaths, there are efforts underway to make naloxone more widely available. In 2010, Diana Pierce's son Michael overdosed on prescription painkillers. Even though a nurse who lived in his building came to his aid, Michael died. Pierce wishes there had been some naloxone on hand.
I think it could have made a difference with him if the nurse had had it, or someone in the apartments, or, yeah, absolutely. It's like, they put the defibrillators everywhere now, just accessible, save people's lives.
To that end, the San Diego County Sheriff's Department wants to put naloxone in the hands of its deputies. When its pilot program is launched this summer, the Santee station will put nasal atomizers filled with naloxone in all of its patrol cars. It will be the first law enforcement agency in California to do so. Captain James Beauvais says San Diego County has seen epidemic levels of drug abuse.
Starting with prescription medication and then really morphing into heroin. And we've had many deaths in all areas, from Poway to Lemon Grove, from children to adults.
Beauvais says sheriff's deputies are usually the first responders on the scene of emergencies. He says giving deputies a tool to save someone from a fatal overdose fits into their mission.
That's our number one priority, is protection of life. And so it's not unusual at all. It's something that they do. And it's just another tool in their bag.
The FDA has just approved an auto-injector form of naloxone. Doctors could prescribe the user-friendly device to family members or friends of people at risk of an overdose.
To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds.
There's also a bill in the California Assembly that would allow pharmacists to dispense naloxone without a doctor's prescription. Some critics worry that widespread availability of naloxone could encourage drug use by eliminating the fear of overdose. But UC San Diego professor Carla Wagner says there's no research to support that claim. She says providing greater access to naloxone is just one step in a broader strategy.
And that strategy needs to involve not only getting naloxone into people's hands, but also educating them about the risk factors and the signs and the symptoms of overdose and how to respond appropriately when they see an overdose. It involves prevention programs that are effective in keeping people from initiating use of opioids in the first place. It includes effective substance abuse treatment.
Prescription drug abuse is America's fastest growing drug problem. Overdoses of prescription painkillers and other narcotics killed more than 16,000 Americans in 2010. Wagner thinks naloxone could be part of the solution.
Increasing availability of naloxone does have the potential to stem the tide of overdose deaths that we see in San Diego County and that we see across the country.
The county sheriff's department estimates each dual-dose kit of naloxone will cost around $45. The department will look for grant funding to cover the $2,500 cost of the pilot program, but they say they'll pay for it themselves if they have to. Kenny Goldberg, KPBS News.